Now, it is my pleasure to introduce today's presenter, Cindy Measurall. Cindy Measurall, Director of Supply Chain Strategy, has been with Cardinal Health since 2004. As a certified Lean Six Sigma Black Belt, Cindy is focused on bridging the gap between the many disciplines of the supply chain and the clinical staff in hospitals. Cindy has worked in numerous areas connected to the supply chain, including operations, transportation, and customer service. Cindy received her Bachelor of Science in Business Administration from the University of Redlands in California. It is now my pleasure to turn the floor over to Cindy to begin today's presentation.
Thank you very much for that kind introduction. As mentioned, I am Cindy Measurall, and I am the Director of Supply Chain Strategy for Cardinal Health. So in my role, I support customers, and my team supports customers to improve their supply chain processes. Every hospital that I meet with has their own way of getting products to the patients. I was even with an account that used red shopping carts to move products from their basement up to the nursing floors, just like the carts you would see at Target. So some ways that our customers use are better than others, but every customer I've been with could benefit from automating their inventory management practices. Some of our customers already realize this, but they're at a loss at where to start. Many are sold on a new technology, but they're having difficulty getting their colleagues and their superiors on board with their idea. So today, I'm going to give you 5 ways to build your case for inventory management. You'll learn not only how to sell your colleagues on the idea, but will also identify the problems that you may not be aware of in your current, more manual processes. So let's get started. Let me briefly share a little bit about Cardinal Health. As one of the largest healthcare supply chains in North America, we are essential to care. We help our health system customers focus on patient care while also reducing cost, enhancing efficiency, and improving quality. We have deep expertise in supply chain and have a strong culture of Lean Six Sigma. We have been recognized by Gartner as the #1 in supply chain innovation for 4 consecutive years from 2011 to 2014. As many of you know, supply chain doesn't stop at your dock. Instead, it leads us all the way to the point of use and up to the patient within the hospital. So we continue to challenge ourselves to innovate and create value, something that all of us in the industry need to be doing in today's dynamic healthcare environment. So you may be asking, or you may already know, what's going on in the industry. Everybody knows that the landscape is changing. There is risk with the new bundled payments, there are concerns about reimbursements, and a constant push to reduce the cost of care. A lot of this is now falling on the shoulders of people in supply chain. Supply chain leaders that I've been meeting with are sharing that they're finding themselves responsible for more than just the hospital. They're now responsible for clinics and medical offices, and even for more than just supplies, including record retention, equipment storage, laundry, even mail, copy centers, couriers, and dietary. And then there's the traditional and constant pricing pressure, the push to reduce the cost of each of the widgets. If you're like many of our customers, you've fought this fight for a long time, and you're reaching a point of diminishing returns on negotiating the prices down. These efforts aren't paying off the way that they used to. Margins have already eroded, and costs have been squeezed as much as they can. As products are quickly becoming commoditized, the pricing pressure is growing, and it keeps piling on. The 2.3% excess tax mandated by the Affordable Care Act has been adding to the cost that we all somehow have to absorb. You may have heard previously that the annual waste for higher value medical devices alone is over $5 billion. Much of this waste is due to poor inventory management. And that doesn't include the hidden value lost due to misaligned labor, product recalls, or non-compliance. You may be asking who pays for that waste. We all do. The manufacturers, providers, payers, and ultimately our patients. This is contributing to a higher payment side of the value equation. Imagine the impact to our industry if we would fix this and tackle that $5 billion of waste. So how can we fix it? Inventory management technology can help solve some of the problem. You may already understand this and are maybe even considering it, but your colleagues get it? Maybe you've already discussed this with your colleagues, but you're getting a sense that they're hesitant to move forward. Change can be difficult for any organization. and there's usually pushback. However, if you put a plan together to build your case, you're more likely to be successful. Before we move forward, I'd like to do a quick poll and learn from you how you're currently managing your inventory in your hospital. A poll question should be popping up on your screen. If you could please just click the answer that best describes the way that you're managing your inventory today. Okay, it looks like we actually have a tie with 38% of you answering manual and 38% answering using a barcode scanner. From what I've seen, a majority of our customers are still doing some sort of manual process, which is typically very cumbersome. We find expired products, lost inventory, etc. And even when folks move up to barcodes, which is a step in the right direction, it still only provides pieces of the information. It's like only reading the middle of the book. You're not getting the full story, and you're missing the best part, what's happening at the end. Thank you for answering that poll question. Next, let's talk about how you can build your case for automated inventory management. To win over your colleagues and your superiors, we recommend following these 5 steps. First, you start by showing how your current state isn't working. I'll walk you through some of the common practices used today and the inefficiencies of those methods. Next, you have to be able to articulate your vision. I'll discuss the qualities of inventory management technology that you should be looking for in a solution. Since every facility is different, it's important to find a solution that fits your needs, not a one-size-fits-all. Third, you'll need to be able to communicate the benefits of change. As I mentioned before, oftentimes when people push for change, they're met with some resistance because change is hard. So I'll explain the common improvements you can see when adopting an inventory management technology. Fourth, and very importantly, you need to gather allies. It's important to establish a team of stakeholders across multiple departments to strengthen your case. And fifth, discover your savings opportunity. By calculating how much you're losing today, you'll begin to understand the size of the opportunity. I'll share with you some questions you can be asking yourself, as well as some results from a successful implementation that we've seen. First, we'll take an in-depth look at the reason your current process may not be working. We will briefly touch on the following methods that many of our customers are using today: consignment, buying in bulk, ordering up to a par level, closed cabinetry, the old-fashioned way of using a piece of paper, and the most common system I see, which is relying on tribal knowledge. Consignment is an important topic. This is an area where there is big spend and historically low visibility or tracking. Consignment sounds good on paper, but it's not solving the problem. In fact, based on the folks that I've spoken to, it's actually not working for anyone either. It's expensive for manufacturers to manage, and that cost is factored into the prices that hospitals are paying. If you think about it, a system that's built on trunk stock and emergency phone calls to a sales rep, managed by somebody who benefits if your products go missing, is just one way this system isn't working. In a recent customer advisory council that we had, there was consensus that consignment was a flawed model, but nobody was really sure of a better way to manage the high-dollar items without a large upfront investment. However, some of our customers are fighting this battle and working towards a repless model. One of the Midwestern hospital systems that we've been working with recently moved away from consignment altogether, and they're actually seeing savings. For ages, our industry's been talking about having the right product at the right time at the right price. But very little do I hear about anybody saying, I want to have just the right amount. Not too much, not too little. So while bulk buys do offer a lower price for the widget, they can tie up capital, misuse space, and they can even be a net negative, because it doesn't matter how cheap you get it for if you don't use it. An estimated 10 to 30% of high dollar physician preference items go to waste. So if you can imagine, 1 in every 3 products may never benefit a patient. It can simply expire on the shelf or become obsolete, end up getting thrown away or in your donate pile that seems to be growing. As I said before, that waste costs us all about $5 billion a year, and that keeps growing. And I was recently with a customer who said that they were no longer going to be performing bulk buys. After doing a study, they found costing them more than they were gaining. Most of the customers I work with use some sort of PAR method to help their reordering process. Some use a printed piece of paper that has the PAR template on it, and others use a handheld scanner, like many of you responded through the poll question. Where that system fails is that PARs are generally determined by somebody's feelings about how much should be on the shelf. Rarely do we see customers setting PARs based on real analytics, which take into account your average daily use, your maximum daily use, and a standard deviation that allows for the variation that you're going to see based on census fluctuation. At one time, the thought was to ask clinicians to use the handheld scanner or push a button to decrement every item they took from inventory to help the reordering process. For good reason, our industry has realized that this is too burdensome for nurses. It's taking time away from patients, and they've shifted the practice. Now it's more common for us to see that nursing staff are only asked to scan patient chargeable items, leaving the inventory management work back with the inventory management technicians. But even for those customers that have used some sort of analysis to set their PARs, the technicians are still counting what's in the bins every day because the automation that they initially invested in isn't working the way that they had planned. So the technicians have to know what's on the shelf to determine what they need to order to get back up to the PAR. So while the shift has moved some of the work off of nurses, a better solution would also remove the need to count every item every day. Closed cabinetry is just one of the PAR level reordering processes. So this method was built with an attempt to automate the inventory management process. What was missed in this method was the impact to the clinicians. If you consider walking up to a closed cabinet, logging in, finding the patient name or the identification number, and then pushing a button for each of the items that you took, has proven to be more time consuming than originally expected. So we've seen customers who've made workarounds. They'll leave the doors open to remove a step from the nursing process, or we see low compliance because a clinician may get the doors open but not push the button for every item that they take. So that means not all items that have been taken have been accounted for. This leaves the inventory management technicians with the same responsibility of counting every single item and then adjusting the on-hand quantity in the system so that they can get the needed amount for the next day. A better future state would be a system that's designed with the clinicians in mind as well as the supply chain team. This may be surprising to some of you, maybe not all based on the poll question results, but many of your peers are still using a piece of paper for their reorder process. Again, it could be a template printed from the MMIS system with PAR information included, but sometimes I still see a blank notepad and folks walking around with a pen writing down the location and quantity that they need. Then they take it downstairs and manually keying an order into the MMIS system. That process requires, again, the manual counting of all the locations to determine what's needed that day. I was recently with a customer in California who used this as their primary method for reordering supplies. Honestly, there were more than 15 people walking around the nursing floor with a blank notepad and a pen in their hand. And at every location, they were just jotting down notes about how much they needed of each item number. At this point, I hope I don't have to explain to you why that's not ideal. Now I'm going to talk about the most common method my team sees, and I mentioned this earlier. It's tribal knowledge, and I'd like to share an example. A couple of weeks ago, I was with a customer who suffered from managing their inventory through tribal knowledge. And their inventory coordinator, who I'll call Betty, she was recruited to a competing hospital. She was great at her job. Subject matter expertise in the OR is hard to come by, folks that have the experience and know what's needed for the surgeons. So this customer has no backup plan that would allow somebody to step in and take Betty's shoes and keep the process going. So her replacement shared with me that he just shoves in as much as he can to ensure that they don't run out. But within 2 minutes, we found 7 different expired products on their shelf. Something that isn't always considered is the fact that these OR inventory coordinators don't have budget responsibility. They're operating out of fear of being yelled at. So to them, carrying excess product doesn't feel like a problem. Everybody around them is happy if they have what they need, so excess doesn't sound bad. The problem with this and all of the other inventory management practices I discussed is that they all come back around to tribal knowledge. Every inventory technician I've spoken with admits that they don't have time to count every item every day, whether it's with a piece of paper or a barcode scanner or a closed cabinet. They just don't have time. So they rely on their tribal knowledge to determine, what am I going to focus on today? What items do I know I just can't run out of? Again, a better way would be a system that doesn't require counting every item every day. But in addition to getting product to the shelf in a timely manner, you also have to think about how you manage your products once it's already on the shelf. The methods we just talked about don't offer the ability to easily capture obsolete or expired products or even manage recalls. If I'm walking around with a piece of paper and somebody tells me there's a recall on item ABC123, how on earth am I going to find that? In addition to that, the new UDI law requires that manufacturers have unique track and trace capabilities at each level for Class 1, Class 2, and Class 3 devices as it rolls out over the next few years. This includes lot tracking and expiration information, which is something most of our customers are struggling with. And even where we have customers that are managing this today, they're either doing it manually with some kind of form that they're filling out, pen and paper, or they're typing it into an Excel spreadsheet. Either way, they've all admitted, I know I'm not catching every item every day. Once you've identified and communicated the challenges with your current state, you want to be able to articulate what you see for the future. Your vision should include a solution that hits these 6 things. The first is it has to be easy to use. Ultimately, the very best inventory management solution is one that reduces the amount of time a clinician has to spend managing inventory. That would allow them to focus more of their time on patient care. But it also has to be easy and intuitive, or they just simply won't use it. They'll come up with workarounds. Next, it has to be accurate. When it comes to your patient's safety and cost management, having an automated system that is 80 or 90 or even 95% accurate isn't acceptable. Proper inventory management in a clinical setting requires full accountability of assets. While 95% accuracy may sound good on paper, this can mean that 5 out of every 100 devices are not adequately tracked. If that device is a $10,000 pacemaker, those lost medical supplies could quickly add up to hundreds of thousands of dollars in waste. This also means that 5% of the products could be expired or recalled without the hospital knowing. When it comes to patient safety, there's no room for error, not even 5%. If only most of your assets are accounted for, your automated system isn't optimized. Third, it needs to provide real-time tracking and charge capture. Many hospital systems audit their inventory once per quarter, sometimes maybe only once per year. That's not giving you the visibility you need to manage your supplies day to day. Real-time automated systems can track inventory levels every few minutes without any human interaction, ensuring that inventory levels are sufficient and that soon-to-be expired product is prioritized or redistributed so it's used before it expires. Even with full visibility across all of the inventories, tracking is a pointless exercise if the appropriate items are not charged for at the patient's bedside. Tracking devices to the point of charge capture ensures that items are accounted for from the storeroom all the way through the charge description master for every procedure every day. Fourth, you need to be able to use trending analytics. We've seen hospitals incur significant losses because PAR levels are either too high or they're too low. Excess PAR levels translate into valuable capital being unnecessarily invested in supplies that you don't need and could expire before use. On the other hand, if you have insufficient inventory, you can lead to product shortages increased patient risk, or even canceled procedures. Analyzing historical trend data and matching the inventory par levels to real usage patterns can lower the overall par levels without risking product shortages, but also allows you to predict and plan for recurring trends. Fifth, you need a solution that's future-proof. Systems that can quickly adapt to emerging technology will extend the life of the investment for years to come. Inventory management solutions should anticipate changes whenever possible and should be built on a flexible framework that allows for innovation. And then last, it needs to be scalable. Inventory management solutions need to be compatible with multiple levels of use across products, across hospital departments, across the health system. Whether it's a cotton swab to a stent, a solution must account for the diversity of your supply while keeping an accurate total view of your inventory. There is obvious value in connecting departments and affiliating hospitals together through inventory management. But the greatest returns can be realized when complete visibility is recognized through the entire hospital system. As I mentioned on the previous slide, scalability is important in choosing a solution. So you may be asking, what does a total inventory management solution even look like? In our experience, we find that there are multiple tools to manage inventory based on the value of the product. It's not one size fits all. You have smart cabinets that can deliver maximum counting accuracy, visibility, and control for high-value items, things like orthopedic implants or sutures, stents, pacemakers, etc. With an open cabinet, you have the ability to just walk up and grab what you need. A clinician simply pulls the product off the shelf and they scan it if they use it. And if it's not used, they can put it back on the shelf and the system automatically reconciles to ensure the inventory is accurate. This way, an access code is never needed. For managing the middle to high value items such as surgical packs, sutures, and case cart supplies, you can use an RFID-enabled handheld wand. So that type of wand features built-in RFID tag readers and a barcode reader, which allows you to begin implementing real-time tracking without a huge infrastructure investment. So that type of scanner works with open or closed shelving and can read up to 75 tags simultaneously in a single wave of the wand. For managing your lower cost supplies that require each level tracking, barcoding is the ideal inventory tool. So it's important to integrate barcoding into the software that allows for a seamless and more holistic inventory view. But when you think about your lowest cost supplies like gauze or bandages, Tube and Kanban is the ideal inventory tool. This is a way to track your inventory and have a notification solution that combines lean management techniques with user-friendly software. It's all about using the right tool for the right product. If you have low-value items like gauze pads and Band-Aids behind an expensive cabinet, you could be giving away your price savings by paying expensive automation fees to store commodity items that far exceed the value of the products themselves. So that would be what we consider overinvesting in your automation. On the flip side, if you have expensive stents and pacemakers that aren't appropriately secured or tracked in your supply chain, you could be underinvesting. It's important to match the investment in the supply chain automation to your needs without underinvesting or overinvesting. You should match the level of investment in your process and technology with the value of the product. Investing in a one-size-fits-all solution isn't going to give you the best ROI. Now that you've painted the picture of your vision, you need to be able to communicate the benefit for change. One of the areas that I focus on with customers is answering the question, so what? Typically, the customers have no issue explaining to me all of the ways their system is broken, why they want something newer or better. What they're not always prepared to do is answer, so what? So what that your system is manual? So what that you have 5 million order lines a year? So what that your pars are set by somebody's opinion? What are the impacts those processes are having on your supply chain, on your health system, on your patients? Additionally, what will a newer, better solution do for you that you don't have the ability to do today? Every time you think through a reason that something isn't working the way you want it to now, you need to be prepared to explain why that's prohibiting you from achieving one of your goals, one of your strategic objectives. This should be one of the focus points as you communicate the benefits of your vision. When you communicate the benefits, you should also be sure to cover how a new solution is going to meet your inventory goals, how it's going to maximize clinical time, how is it going to manage the inventory after it's already on the shelf, how it will improve charge capture and allow you to make more informed decisions based on real analytics. An obvious benefit to communicate is that in your future state, you'll be able to have the right product at the right place at the right time with the right amount, with a solution that's simple and visible. It sounds basic, but our industry has struggled with this for as long as I can remember. Improving your processes through automated inventory management is the vehicle to get you to a state where you can remove excess without concerning yourself with running out of product. Recent studies have shown that nurses can spend up to 20% of their time on supply chain activities, such as searching for product or picking cases, depending on what department they're in. Think through how you can improve your labor cost efficiencies if your nurses spent that time taking care of patients instead. For example, in many hospitals where nurses are required to pull products from a closed cabinet system, their process is to walk over to the cabinet that's electronically locked, sign in, find the product they want, either because they know where it's at or they may need to scroll through a screen to have it tell them where the product is located on the shelf. Then they have to type in the patient name or ID and attach the product to the patient. That could take anywhere from 55 to 75 seconds, depending on how many products they need to pull. And then if they have unused product they need to put back, they need to do that all over again. That's taking up time. There is a national nursing initiative called TCAD, or Transitioning Care at the Patient Bedside. The goal of this is to increase nursing time spent on direct patient care. This should assist in quality outcomes and patient satisfaction. We already know that there's a correlation between nursing time with patient and the likelihood for readmission. And we also know that readmission within 30 days for the same clinical condition is a sentinel event. I would rather have nurses ensuring that patients understand how to take care of their meds or apply their dressings correctly than have them hunting for or managing supplies. So if you think for a minute about your HCAHPS scores, the vast majority of that 32-question survey addresses nursing care. For example, in one of the sections about nursing, it asks, during your hospital stay, after you pressed a call button, how often did you get help as soon as you wanted it? Those HCAHPS scores have a direct correlation on your revenue under the Affordable Care Act. So the patient experience of care is a significant factor in the hospital value-based purchasing program, making up to 25 to 30% of your total performance score through 2016. CMS will up the ante over the next few years, with 2% of reimbursement dollars ultimately being at risk by 2017. With the growing amount of revenue at stake, hospitals must be looking for strategies to improve the patient experience and boost their HCAHPS scores. Supply chain processes can contribute here, freeing up clinicians from supply chain activity and optimizing clinical workflows. This would ensure that patients are getting the proper care at the right cost. Your new solution should also support your patient safety initiatives. According to the FDA, there were nearly 1,200 product recalls in 2012. 99% of all product recalls are handled manually. So while you communicate the benefits of change, managing recalls and reducing expiry should absolutely be included. You should have the ability to easily remove recalled products from the shelf, not hunting for them with a piece of paper and a pen. You should also easily be able to find patients that may have been impacted by recalled products. Data gathered from RFID technology and inventory management is robust and actionable. These insights can guide decision-making and produce positive results in the following areas. You can have outcomes that are linked to products and practices. You have waste that becomes visible and measurable and avoidable. You have working capital that can be reallocated. You can reduce the true product cost. You have healthcare industry staffing that can be reorganized to reflect the insights culled from the supply chain, allowing clinicians to more fully focus on patient care instead of on supply chain tasks. At an IDN enterprise level, RFID endows healthcare providers with invaluable data across all departments and facilities. The total cost of such solutions often comes as a surprise to hospital administrators as well. While many may think that RFID is prohibitively expensive, advances in the technology have driven the cost down to a point where passive tags are now 30 to 50 cents compared to the more expensive active tags that are used for capital asset tracking and location services. When it comes to the bottom line, the RFID solution often pays for themselves in 1 to 2 years. Even if you're moving to a more value-based reimbursement model, much of the revenue is still tied to fee-for-service. Every year, healthcare providers lose more than $1.8 billion to revenue leakage, an average of 7% to every facility. A leading cause of this is inaccurate charge capture. If you think about a clinician's job, they're likely manually tracking every product that's used on a patient and then entering it into the EMR. This is most prevalent during surgeries or procedures where the most expensive items are used. Without a point-of-care tracking system, items are going to get missed, which leads to the revenue leakage. By adding a point-of-use station, the clinician is able to easily link particular supplies to the patient, to the procedure, the room, the case type, and all the more is at the point of care. Items that are waived or scanned at the point-of-use station are flagged as used and connected to the appropriate patient and procedure, ensuring that your billing and clinical documentation are accurate. Not only have you improved your documentation accuracy, but you've also simplified the process for the clinician, allowing them again to focus on what they should be focusing on, the patient. Now that you understand the benefits, it's time to gather your allies. There is definitely strength in numbers. When creating your council, think about the folks that are most affected by the current process. Think about their potential pain points and how an automated system could benefit them. Go talk to the folks that are being impacted today. Find out from them what positive impact it would have on them and their team members. Also think about the different departments that are impacted. Make sure you include representation from clinical leadership, materials management, purchasing, finance, and any other corporate stakeholders that you might have. If you remember all of the benefits we just talked about earlier that an automated system can provide, there's a good chance that you're going to need to put that knowledge to use in creating this council. You will most likely need to articulate the benefits to get these folks on board. But once you've sold them on the vision and they understand the benefits for them to move forward with change, now you need to ask them for their support and backing. Ask them to be a champion from their department. The more champions you have, the better. It's also important to clearly define everybody's role within the council. This way, everyone can work individually towards their goal, but the entire council will be moving simultaneously towards the larger goal. However, if you're struggling to make headway with the different departments, you're not alone. Within the hospital, there are many business units who aren't always on the same page or even talk the same language. In communication between these units, it can be difficult to get everybody on board. One option that we've seen is bringing in external support, having an external set of eyes review your current state and identify areas for opportunity, and can help you articulate your business case. That suddenly gives you a nonpartisan heavyweight that's on your side. Consider someone who can understand all of the different verticals within the organization that can also objectively articulate the case for change. One health system that my team recently worked with brought us in for this specific purpose. The inventory management team felt the pain. They knew that there was something wrong, but they were struggling with articulating to senior management just how broken it was and just how impactful their process was to the overall organization. Once the message was delivered and senior management clearly understood the picture and the negative impact, they were immediately on board with updating their inventory management system. One important aspect of any business case is the financial benefit. The final step of our recommendation is to determine your savings opportunity. In order to estimate your savings potential, you have to understand where you are today. Where are you not operating as efficiently as you could be? And what is the cost for the inefficiency? Here are some questions you can be asking yourself. How much are you losing today due to expired or recalled products? How often are you shipping product overnight? How much time are your clinicians really spending on supply chain activity? How much overstock do you have? How much time are you spending during the reorder process? If you don't know the answer to all of these questions, I promise you're not alone. These are just a few of the questions, though, that you can start digging into to identify your savings opportunities. Think about how much waste is going on that you maybe never even considered before. Another thing that you can do is review the success of others. That can help you understand your own opportunities and ultimately strengthen your own case. So let's take a look at an implementation at Emory St. Joseph's Hospital. When Emory St. Joseph's in Atlanta first decided to update their inventory management and usage tracking system, their plan was to implement barcoding into high-volume procedure areas, the cardiac cath lab and the EP lab. This is going to take a year to implement, and they were looking at extensive new construction to support it. When they were introduced to the complete Cardinal Health RFID solution, that became their game changer. Emory St. Joseph saw that there would be an immediate ROI with minimal investment of time and IT resources. Suddenly, they realized that barcoding can't tell you what inventory you have on hand every minute of every day. The RFID solution delivered unprecedented visibility, providing an effective, data-driven tool to optimize their inventory, but also improve patient safety and clinical satisfaction. As soon as the solution was implemented, they started to immediately see the results. They found a 60% improvement on inventory turns. They completely eliminated their premium freight charges due to stocking out of product. And they realized an 80% reduction in expired and obsolete products through having 100% tracking and control. They also recovered $300,000 in product costs that were lost through their previous processes. And this is just one example. But if you can, imagine if they had just moved forward with the barcoding. All of the savings I just described would not have been realized. And that's why it's important to understand all of your options and pick a solution that works best for your facility. So speaking of your facility, I'm hoping that you're starting to envision what similar results could do for you. And now is the time to build your case. As you consider taking the step towards improving your supply chain, improving clinical satisfaction, and patient safety through an inventory automation, remember to include the 5 steps that we walked through. Start by showing how your current state isn't working. Then articulate your vision. Communicate the benefits of changing, gather your allies, get people on board, and then discover your savings opportunity. I'd like to thank you all for your time and attention today, and I would be happy now to answer the questions that you have.
Thank you, Cindy. That was a very informative and enjoyable presentation. We will now begin the Q&A portion of the program. As a reminder to our audience, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenter will attempt to answer as many questions as she can during the time we have for Q&A. Now for our first question from the audience. I'm currently using barcoding technology to manage my inventory. How does this technology compare to the technology you mentioned?
Thank you for the question. So the first type of technology that I mentioned was RFID, or radio frequency identification, for those of you that didn't know. The most important difference between RFID and barcoding is the ability to have line of sight. So when you scan an item with a barcode, if you think through it, you have to line up the barcode scanner with the barcode for every item. So that can be really cumbersome if you have hundreds of SKUs. As opposed to if your products are tagged with an RFID tag, you can, again, wave a wand, which could read over 100 tags in 1 second, or the products can be sitting in an RFID reading cabinet that can read them immediately. So that makes a huge difference in the amount of impact or energy that your staff members have to spend to manage the inventory. Another big difference is that an RFID tag can hold more information than a single barcode. So it can include a lot number, a serial number, expiration date. So with a barcode, you may have multiple barcodes on a box of product, one for the serial number, one for the lot number, right? So that would be multiple things to barcode scan versus an RFID tag that can hold all of that information at once. So when you compare the two different processes, you still have to cycle count with the barcode scanner as opposed to RFID that reads it all and counts it all very quickly. Thank you again for that question.
Thank you, Cindy. Here is our next question from the audience. Can small rural hospitals afford this kind of technology?
You know, that's a great question. Even rural hospitals can benefit from automation. But as I mentioned in the presentation, you should aim to adopt a solution that's scalable for your hospital. You can start in a procedural area and then expand when you see the cost savings and make a larger investment based on the savings that you see. We have customers that we've worked with that exclusively want to focus on their med-surg floor and the low-cost supplies. Some of our customers want to focus on their high-value supplies in their cath lab. Some of our customers want to tackle both at the same time. So again, because our solution isn't one size fits all, you can start in one area and reap the benefits and then expand as you see fit in the way that you want to improve your particular hospital. And that's actually a good way to get your colleagues on board. If you can start in one area and have a quick win and see the savings, that can help you build your case for expansion.
Perfect. Well, that segues into our next question. What are some steps that we can take for our clinicians to better understand the business side of inventory management and how the use of an automated system can help them?
You know, that's a great question because it gets back to the importance of gathering your allies. You have to get buy-in from clinicians because they're the ones that are going to be using the technology that you employ. And if they don't like it, they're not going to use it. And their voice is going to be louder than any other voice that you hear. I'm sure that you know that already. So to gain their buy-in, you have to start by asking them about their pain points. What are they doing today that they don't like? How much involvement do they have that they don't want to have? They're probably going to tell you that they're spending way too much time picking products or counting products or looking for the products that they need and that they wish somebody else would do it for them. They may even tell you that they just know off the top of their head what Dr. Jones is going to use tomorrow, and that's how they place orders. So you need to be able to tell them about the benefits that they would realize by having an automated system, getting rid of all of those cumbersome practices of counting and hunting. And then tell them that they can spend more time with their patients, that they could have a simpler workflow, that they wouldn't have to worry about having too much or too little on hand. Because once you have a clinician on board, you can convince anybody else. And most of the time, it's them, it's the clinicians who you've got to gain their trust and their support to move the whole project along.
Perfect, thank you. So for our next question, does this technology link with our current systems?
Well, that depends on the solution that you adopt because different technologies have different capabilities. So the inventory management technology that you choose should be the best fit for your hospital and health system, and it should definitely interface with the system's EMR. So that's important for two reasons. One, for compliance. The easier it is to use the system, the more likely that your staff is going to be willing to use it and adopt it. But secondly, it's got to be able to be used for charge capture. So we already talked about the benefits of improving your charge capture, right, adding additional revenue for the hospital. So if you can charge a product to a patient at the point of use, you're eliminating that waste, the waste of the lost charge. So make sure you do your research and know that what technology is going to work for you and interfaces with the systems that you already have.
Okay, that makes a lot of sense. So now we have an audience member who would like to know the following. You did not touch on the issue of missing or misplaced items. This is one of the biggest issues we face, and my staff doesn't seem to care about the money we are losing. Can you provide more insight into how technology can help to fix this issue and how I can sell that to my staff?
Great. Another great question. Missing items or misplaced items is a huge problem, and for you who asked, you're definitely not the only one dealing with this. So it's great that you're looking for a way to solve it because many of your peers have not gotten that far. It's also not surprising to me that your staff's not concerned about revenue leakage. So you need to make sure that you're thinking about how that affects their day-to-day job. So it's probably too difficult for them now to track and trace each item manually, and that's why things are going missing or not accounted for. And all that extra work is not worth the money to them. So RFID is really helpful in this type of situation because you could, again, have products in a cabinet that tracks the items at all times when it's in the cabinet. So for your case, it would record the time that the item was put on the cabinet, the time the item was removed from the cabinet, which would allow you to track down any missing items. So you can ask questions like, why were 4 items removed at the same time, but only 1 was charged to the patient? Or why are 4 items removed every time we have one of these procedures? That can help you dig into what's happening in the procedure room. And that can help you evaluate which products are picked for certain cases. So when you think about selling this type of technology to your staff members, the RFID reading cabinets are most likely to be simpler than what you're doing today. Because again, you can simply pull the product off the shelf that you need, charge it to the patient in the room, and if you don't use it, you put it back, and the system counts it and tracks it for you, which also helps with organization. RFID technology will cycle count for you, as I mentioned earlier. So you can also tell how much you have, when something's missing, when it's going to expire. If something went on recall, it'll tell you where it's at. In general, it just simplifies the entire process, and I'm confident that your staff would thank you for that.
Perfect. Well, we have time for one last question. I have an audience member who would like to know, how much does this solution cost and how is it priced out?
That's the question everybody always asks. But the price of the solution really does depend on the size of the implementation, and that could vary depending on the needs of each individual hospital. 2 of the key aspects that greatly affect the overall price would be the number of departments and the type of supplies. So a customer can typically expect a reduction in capital the first year, followed by sustained improvement thereafter. So that would be influenced by the elimination of expired product, obsolete product, as well as smoothing out the effect of having the right amount of inventory on hand. So again, not too much or not too little. So we've seen full ROIs that happen in less than a year, meaning that the solution pays for itself within the first year. But as I mentioned, the uniqueness of our solution is the scalability. So it can be used in a small supply room and expanded into multiple procedure areas. During an assessment, we can work with individual customers to understand their pain points and help prioritize what they need to manage the problems that they're having, and then expand and grow as they build their case for more inventory management and receive more and more staff buy-in. So again, the answer is really depends, right? It just depends on how big or how little and how many rooms and what type of products you're managing.
Well, that makes a lot of sense. Thank you. That's all the time we have today for the Q&A. I want to thank Cindy again for her excellent presentation and all of you for participating today. We look forward to having you join us for future webinars. This concludes today's program. Have a wonderful afternoon.